Welcome back. It's 8:45. Even a run-of-the-mill headache can ruin your day, but the pain from migraine headaches can be excruciating, and it can put you out of commission for days. Migraines are widely misunderstood. They're still being studied. Those who suffer from them sometimes feel they can't talk about the condition. Joining us this morning is Dr. Simon Fishman, a board-certified neurologist and director of integrated neurology services. Good morning. Thanks for coming in.
Thanks for having me.
Oh, you know, there are a lot of people out there who suffer from this condition. I want to try to squeeze in as much information as we can. First, approximately how many people suffer from migraines?
If you look at the official statistics, it's about 30 million. But really, if you break down the statistics, it's 3-to-1 ratio of women to men. And it's about 1 in 5 women will have a migraine sometime in their life.
And do we know why they affect women disproportionately?
The short answer is hormones. Before puberty, girls and boys have equal frequency of migraines. As women mature, they develop a 3-to-1 ratio of women to men, and that's primarily during times of hormonal irregularities. So we're talking about young girls as they're having their first cycle. We're talking about women around reproductive age who are either going on birth control, coming off birth control, or just gave birth. And we're talking about women in menopause who have these irregular hormonal levels that fluctuate tremendously.
All right, so what might trigger it in men?
Well, in men, clearly it's not the hormones that are as big a role, but normal triggers like stress, sleep deprivation, certain foods, barometric pressure changes. So I know I have a lot of patients who can tell me when a big storm is coming because they feel migraine-y. They know the next morning they're going to wake up, and often they will treat prophylactically, prevent the migraine because they know there's a pressure system coming in.
Wow. And how would they treat, how would they do that in advance?
Well, a lot of times treating migraines is getting to them early, but even in advance, you can take over-the-counter medicines that work well. I prescribe a lot of naproxen, or take certain medicines that we use for other things like anti-nausea medicine the night before when you think a big storm is coming.
You were telling me just before we went on the air about some foods that seem to play into the whole migraine scenario.
That's absolutely true, that migraines can be triggered by certain foods, foods that are high in tyramine and nitrates. So we're talking about aged cheeses, red wines, anything that's highly processed, made to sit on a shelf for a long time. And foods and other triggers are the first line of treatment to avoid the trigger. So if you know every time you have Chinese food, you're going to have a migraine, you may want to maybe avoid a Chinese restaurant for your choice of dinner.
But there is no cure at this point for migraine.
There isn't a cure. This is a chronic disease that we manage through the entire life cycle. And people will have long periods where they don't have migraines, and all of a sudden, out of the blue, they may have a whole bunch of migraines.
Okay, I want to talk about this other element, and this was surprising to me. The fact that a lot of people feel they can't talk about it, and that there's a stigma of sorts attached to migraine headaches.
That's absolutely true, and the study that triggered a lot of this conversation compared patients who have a lot of migraines to patients who have epilepsy, and they found that the stigma is even worse in people who have migraines, lots of migraines, than people who have epilepsy, there's been a long-term stigma associated with that. And a lot of that has to do with missing work. We can't see how much pain somebody's in. We can see a broken ankle, we can see somebody passing out, so it's always subjective. I think there's a certain amount of chauvinism to it as well because it's a majority of women.
I got you.
And I also think that women try to power through it because this affects women in the most productive time of life between 15 and 45. And so they're juggling kids and they're juggling the workforce, and they're not going to call out sick, so they come to work, but they're not productive. And so on one hand, they don't want to tell anybody they're having migraines because they don't want to be called weak. On the other hand, they don't perform as well because they're really incapacitated.
Suffering, yeah. That's unfortunate that people, but now I see what you're saying. I understand. You know, people you can't see it, and you just feel like, yeah, all right. Yeah, I came to work with a headache. What's the big deal? It's that kind of thing.
Correct. And the disabling features, and it is a disabling disease, aren't just the headache. So pain is very much an issue with migraines, but also the visual loss, the nausea and vomiting, the spinning sensation in your head, feeling like you're going to pass out. So I have patients who don't have bad headaches, but they lose vision.
Sure, right, right.
If you drive for a living, you're trying to drive to work, and you suddenly lose vision and get a headache, well, you're not getting to work.
Everyone needs to take it more seriously, obviously. If people want more information about this kind of thing, where can they go?
Well, there's plenty of good sources on the internet, the WebMD, and there's the International Headache Society. You can also go to our website, which is integratedneurologyservices.com, and we have a lot of information on migraines there as well.
All right, Dr. Simon Fishman, board-certified neurologist, director of Integrated Neurology Services. Thank you very much for coming in. We appreciate it.
Thanks for having me.